Hello, my name is Joanne Hum. I'm a registered nurse and Master of Nursing student at Athabasca University. This is my video submission for Nursing 608, Lunch with a Nursing Theorist, where I'll be having lunch with Imogene King and discussing her theory of goal attainment. I chose this particular theory because in my practice area of palliative care, there's a lot of misguided fear around what palliative care is. There seems to be an assumption that once a patient is, quote, palliative, that means that healthcare providers have given up and that the patient no longer receives any type of care. This is obviously far from the truth, and I wanted to show how active interventions, such as those in goal attainment theory, could effectively be applied in a palliative care setting. The theory of goal attainment is a middle-range theory that was developed by Imogene King in the 1960s. It states that nursing is a process where the nurse and client interact and share information, set mutual goals, and the means to achieve them. This theory is closely tied to the nursing process, where all aspects of nursing care are directed towards goal attainment. This theory identifies the nurse-client relationship as the essential process to facilitate patient health. Goal attainment theory consists of three interacting systems. The patient and nurse each are personal systems that bring perceptions of self, their role, and levels of growth and development. When they interact, they form an interpersonal system. In goal attainment theory, this relationship is the essential system to facilitate health. The theory also recognizes the larger social system, which includes religious, educational, and healthcare organizations, and its impact on health and nursing. The theory focuses on the nurse-patient interaction, where the nurse and patient share information related to a situation. For example, a patient tells a nurse that he fell off his mountain bike and hasn't been able to move or touch his ankle since then. The nurse asks more questions and completes her assessment, and based on this, the patient perceives the nurse to be competent. This is an example of an interaction. As the patient continues to interact with the environment, including the nurse and hospital, the patient and nurse set goals and plan how to achieve them. In the same fictional example, the patient agrees to surgery and establishes the goals to return home and recover full function. The multiple interactions that ultimately lead to the patient's goal attainment is considered a transaction. For this lunch with Imogene King, I chose to have a picnic on Machu Picchu, an Inca fortress located in Peru and considered by many to be one of the 7 wonders of the world. I thought that the setting was very appropriate because we would be discussing her theory of goal attainment, and climbing Machu Picchu is on my personal bucket list of life goals of places to see. Not only that, I recognize that the picnic would be at the end of a very challenging hike up a mountain that would require assistance from a guide, which I think is similar to the role that nurses play in helping patients achieve their health goals. During lunch, I would ask Imogene King the following questions. 1. You define nursing as a process, focusing on what nurses do and how they do it in order to help patients achieve their goals. What value, if any, does the art of nursing have in your theory? The rationale for this question is that I noticed her theory focuses on nursing acts and processes. In my practice area of palliative care, nursing art, things like silence and therapeutic presence, are an essential part of establishing an effective nurse-patient relationship, and I wanted to know how she would acknowledge this aspect of nursing in her theory. 2. A criticism of your theory is that it requires active communication between patient and nurse in order to be effective. How do you suggest nurses facilitate goal attainment with patients who are unconscious, have mental illness, or impaired cognitive function? The second question comes from the biggest overall criticism of her theory. I asked this question because I wanted her to comment on how she would apply the theory to situations where communication between the patient and nurse is unclear or challenging. 3. You developed your theory in the 1960s when nursing practice and education were very different than they are today. How would you adapt your theory to modern nursing practice? This final question acknowledges the changes in nursing since the theory of goal attainment was originally developed and examines the adaptability of her theory to change. I was particularly curious to know which changes she identifies as having the biggest impact on her theory. The following is an example of goal attainment theory applied in clinical practice. The patient was a 54-year-old male diagnosed with pancreatic cancer, presented to emergency with recurrent bowel obstruction. Through the process of patient-nurse interaction, goals were established to resolve the bowel obstruction so that the patient could eat, get physiotherapy, and gain enough strength to be discharged home. Unfortunately, the obstruction did not resolve, and the patient received new information that he would not be well enough to return home. Through further patient-nurse interactions, new goals were set. The patient wanted to complete his will, distribute his belongings, and agreed to start the process for transfer to hospice. During this process, the patient's condition rapidly deteriorated. Further information was shared with the patient that he was no longer stable for hospice transfer and that his prognosis was short, in the matter of hours to days. Although the patient was emotional, he was able to set new goals, to see his closest friends to say goodbye, and for nurses to ensure that he did not suffer from any pain or die alone. The patient ultimately achieved these final goals and passed away peacefully the next day. This example illustrates the theory of goal attainment in practice, recognizing the role of nurse-client relationship to establish and strive to achieve new goals even as the patient's condition changed. This was a result of the patient being very clear and able to communicate his wishes and needs up until the very last few hours before his death. This next case involves an 85-year-old male with prostate cancer and dementia who presented to the hospital with hematuria and delirium. The patient did not have any social supports other than his wife, who unfortunately also suffered from dementia. Basic patient-nurse interactions were often based on incomplete or inaccurate information. For example, in regards to pain, the patient would deny that he had any pain with one nurse, but then tell another that he always had pain. Some days he would say he had pain in his back, and other times it was in his neck or stomach. It was also very difficult to establish any goals of care, as the patient and his wife had very limited understanding of illness and often made contradicting medical decisions. For example, on several occasions, the patient stated he wanted to focus on comfort and didn't want further blood work or investigations, but then agreed to active medical interventions such as CBI and IV fluids. Those of us who were involved in this patient's care shared a sense of dissatisfaction with what we were doing, as we never felt confident he truly understood what he was agreeing to or declining, and felt that the hospital environment was ultimately contributing to his suffering. The theory of goal attainment unfortunately does not address these types of situations where the patient is unable to accurately communicate with his or her environment. The key tenet of the theory, that of the patient-nurse interaction leading to transaction and goal achievement, cannot occur when one of the personal systems is unable to fully communicate with the other. One of the propositions in the theory states that if a nurse with special knowledge communicates appropriate information to the patient, mutual goal setting and goal achievement will occur. As illustrated in this example, goal setting and attainment could not occur even with the nurses providing information to the patient and his wife. Goal attainment theory recognizes the importance of the patient-nurse interaction in assisting patients to maintain health. As demonstrated in my first practice example, it can be applied in most nursing situations and areas of practice, including palliative care. However, goal attainment theory is limited to situations where patients can fully communicate and contribute to interactions with the nurse and environment. Thank you for this opportunity to have lunch with Imogene King on top of Machu Picchu and learn about her theory of goal attainment.